And we do welcome you back to GMA and our ongoing series, One Match, Second Chance. It's been 10 years since a bone marrow transplant saved my life. And this morning we're joined by two doctors who are on both sides of this miraculous process. Dr. Ron Jacob of Be The Match specializes in enrolling potential donors, and Dr. Arif Kamal, the Chief Patient Officer at the American Cancer Society. Thank you, gentlemen. Thank you. A little bone marrow donation 101, because we get so many questions from viewers. And Dr. Jacob, let's take everybody from swab to donation, something you know personally.
Yes, Robin. As you do know, I was a donor. I was lucky enough to donate to a patient a few years ago. And the registration process is simple. You register online, you receive a swab that's mailed to you, you swab the inside of your cheek, and then you drop it back in the mailbox, and it goes to our biorepository. That's our lab where we do the typing for an antigen called HLA. It's a little more complex than blood typing. Once that is typed, you're put onto the registry, and then we just sit back and wait. At that point, physicians of these patients can search to see if you are a match, and when you're a match, you'll be informed. Our request is that you remain committed to becoming a donor.
Dr. Kamal, you care for patients who receive transplants, and we have a question from one viewer who may need a donor.
Hi, my name is Marissa. I have acute lymphoblastic leukemia. I might need a bone marrow transplant at some point. Can you tell me what I should expect?
Yeah, simply put, there's 5 steps involved. The first is the ever important conversation between the patient, their caregiver, and their medical team about what the next steps are, the logistics and the urgency of the transplant. Second, then, is finding the match. You need to have a donor to give you cells to help you recover from the high chemotherapy process that we're about to start. And the third is the actual transplant itself. What we're doing is providing people with high doses of chemotherapy, immunotherapy, or radiation with the idea that we're trying to kill every single cancer cell that's there, and then we use the donor cells to come in and rescue that person so that they can function normally. Next, then, is the treatment recovery part. What you've got is donor cells and the person's own cells kind of dancing together. They're like roommates who have to get to know each other. And in that process, it takes a little bit of time, sometimes a little bit of medications, because they got to figure out who's going to do what as the body functions normally moving forward. And lastly is evolution and supportive and palliative care. People have great quality of life now, almost really mimicking what they had as a new normal from before they were even diagnosed.
My sister was my donor. We didn't get along as kids, and I was worried that they would be in there like, hey, get out of it! But it all worked out in the end.
Thank goodness.
I know, I was like, oh.
Oh, Dr. Jacob, we have one more question from another potential donor. Check it out.
My name is Tobias Wilson Jr. I'm a senior at Hampton University, and my question is, how many times a year would I have to donate if I joined the Be The Match registry?
Okay, sounds like Tobias is ready to be a donor. Let's give him an answer, but also, what are the most frequent questions you're asked?
Sure, and Tobias, thank you for that question. I'm excited that there are people like Tobias who want to donate to multiple people, but with Be The Match, our policy is that it's a maximum of 2 recipients over your lifetime. Now, as far as common questions, one of the most common questions we hear is, what does it take for me to register? And we say the requirement is you have to be 18 to 40 years old to join the registry. The reason is medical research has shown that cells from younger donors lead to better outcome. Then obviously the other common question is, pain, does it hurt?
Yeah.
As we mentioned before, I'm a donor. I donated through peripheral blood stem cell donation, PBSC. It's done 85% of the time, and that means that the natural blood stem cells that exist in your bloodstream are extracted and used for that recipient. 15% of the time we still do the marrow donation, but that is under general anesthesia, so there is no pain in the process. And then the most common question after that is, does this cost the donor anything? No cost at all to the donor, because Be The Match takes care of all the expenses. We'll take care of travel, we'll take care of child and pet care, anything of that sort. That's something that Be The Match takes care of.
Wow.
Yeah, and when you're a donor and you're doing that, I think my sister only had to work miss a few days of work. People think that they have to be out of work for an extended period of time, but that's not really the case.
Robin, I donated on a Tuesday. I took Wednesday off. Thursday, I was back at work. Friday, I was flying from New York to Dallas for a meeting.
Yeah, that's it. Can I just talk about and I know I talk with the guys all the time, not all the time. I can't even remember, that it was 10 years ago. But the advancements, when I see people who come up to me and say that they are a bone marrow transplant recipient, and I look at them and they're only like a year out or 2 years out, There is hope. There is hope, isn't there?
There's a ton of hope, and a lot has happened in the last 10 years. I mean, let's look at match probability, right? At a time when you were starting to go through that match process, that probability might have been 25%, because we were generally looking at siblings, right? If you had a brother or sister who could donate. Now we've gotten a lot more creative, right? Now what we are is able to look at children, parents. We're able to look at other family members as well. And as the registry grows and becomes more diverse, we're able to have more probable matches. What that means now is we've gone from 25% to 50 or even 75% in certain populations. Really amazing.
Wow.
Yeah. And what would you add to that, Dr. Jacob?
I think it's a numbers game. You know, because of the support of individuals like you, Be the Match has set a record last year for most donations facilitated. And our request is we have more people register, more lives will be saved.
I know our GMA viewers, they always come through.
They do.
Thank you both so very, very much. Appreciate that. Wearing the Be the Match blue. I see that. I got you. Hey, scan the QR code on your screen to go to the Be the Match website for everything you need to know to become a donor and save lives. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.